messaging this morning in our meeting. The meeting is being live streamed. It's a Zoom meeting, so we ask you to use all your usual good Zoom protocol and etiquette. I want to note that this month, October of 2022, is our 2-year anniversary as a working team. We first came together in October of 2020. And at that time, we came together. We reached out to build new and stronger and more inclusive leadership. We built trust together. We took a look with the help of the DuPage County Health Department and their disaggregated data. We looked at the impact of COVID, case counts, morbidity, and mortality, and we used that information to spur action. We distributed protective equipment. We organized vaccination events and other vaccine strategies. We surveyed and built relationships of trust in the community to understand where the hesitancies were to vaccine and what we could do about that. We hosted community education, and now we've entered together a new strategic planning process known as ARISE. In our meeting today, we're going to take some time to talk about the ARISE project, get a sense of where it's at and where it's going and how it fits into our mission of equity at heart. We're also going to invite an update regarding another really important initiative on communication and trust building in the community known as the IVACS project. We're going to invite a number of partners in the meeting today to share what's going on with them, what's working, what are the concerns, and what could members of this team do in support of that vaccination confidence building project. We're going to engage all of you regarding what's most important for us to be paying attention to at this table. As we're also involved in this ARISE strategic planning process, we also want to make sure that at this meeting, this monthly meeting, we're attending to what's most important, and we're going to ask you about that. And then finally, something that we're not going to do today, this is my apology to the whole group. I was to be here today with information about language access and helping us to determine our best path forward for interpretation and translation as a routine habit of ours. And the honest truth is I've not prepared that. So I'm asking your forgiveness, but I promise that we will attend to that in the future. So we have with us today a number of new folks, and we have some folks who are coming back to be with us. What I'd like to do right now is invite people who are new to us to introduce themselves. There are just a couple, not a lot, but I want to take a moment. If this is the first time that you've come to this meeting, would you please unmute and help us understand who you are, who you affiliate with, and what brings you to this table, this meeting.
I'll go ahead and start.
Thanks, Lisa.
My name is Lisa Snipes. I'm currently serving as the Continuum Planner for the DuPage County Continuum of Care. I would like to thank Kara Murphy for inviting me to the Heart Work Group. I'm here to learn more. This unfortunately will be the only meeting that I will be able to attend for the rest of this year. And I apologize for that. Unfortunately, the next 2 Fridays for November and December are not going to work for me. But I'm interested in learning more about the Heart Work Group. I actually used much of your material in a recent, actually in the last 2 years worth of applications for the HUD Notice of Funding Opportunity. So the Continuum of Care, our mission is to prevent and end homelessness to develop strategies to prevent and end homelessness within DuPage County. I work with many of you. I look forward to working with many more. I believe that the work that you do impacts and touches so much of our provider partners, and I know that you've worked with all of them at different points in time, not only since your inception, but moving forward to prevent further disease outbreaks, as well as working on a healthier DuPage County. So I'm looking forward to being a part of this group as we move forward. Thank you.
Thanks, Lisa. It's very good to have you here. Let's see, who else is with us for the first time? I want to invite you to introduce yourself.
Good morning. My name is Dane Alexander. I am with the American Heart Association. I am based out of the collar counties of Cook, so that'd be Will, DuPage, and Kane, and Northwest Indiana. I am very new to the organization. This is only my 3rd month, so I am happy to be here. I'm just here to listen and learn, and it's a pleasure to be here.
Very good, Dane. It's great to have you here. Welcome. All right, so we're inviting those folks who are with us for the first time to introduce themselves, let us know where you're coming from and what it is that brings you to this health equity table. And at the risk of making an error to someone who may have been a good friend with us a long time, I'm going to take a chance here. Margaret, could I invite you to introduce yourself?
Yes, actually, this is my second
Second,
meeting.
I knew it. I knew it.
Yeah. I am Margaret Childress. I am with DuPage County NAACP with the Health Committee. I am also the branch's secretary and the chair for the Communications, Press, and Publicity Committee. And I'm here to learn and do what I can do to help.
Welcome, Margaret.
Thank you.
It's good to have you back. And Gabby, I see you've put your screen on. Could you introduce yourself?
Of course, thank you. I'm Gabby Tafoya from the Addison Public Library. I'm the head of community engagement. So I'm really here to listen and just to learn what else we can do to kind of help promote any healthcare initiatives and just share any information.
Thanks, Gabby. It's good to have you here. It's good to have a library perspective and an Addison perspective. Let's see, as I look around, Elizabeth, are you, I don't know if you're able to hear this because I don't see a screen, but if you are listening, are you able to introduce yourself?
Yes, of course. Hi, David.
Hi, Elizabeth.
I am currently mobile heading my way into the office. So I'll be with you guys shortly. But I'm Elizabeth Cervantes with Southwest Suburban Immigrant Project. This is actually my first meeting here, but other colleagues at SSIP have been part of this space before. So I'm just glad that today I'm able to join you all, and I see some familiar faces. So only have heard great things from this space.
Thanks, Elizabeth, and welcome to the table. And you are right, SSIP has been a crucial partner in Heart from the beginning. Anyone else who is here for the first time? All right, good. Well, welcome everybody. All right, so let's start this meeting then with the fullness. We have some fullness going on in our community. We have 3 community partners who are represented here today, NAACP and Immigrant Solidarity DuPage and the Southwest Suburban Immigrant Project, who are involved in a hyper local communications outreach to build confidence and outreach regarding vaccination. And we want to invite them today to share what's happening with them, what's going well in that project, what concerns them, and what are things that we could be doing as a team to support them in their work. So we don't have a predetermined order, I don't think, for that group. I just want to invite any representative from those organizations to step out there and engage us.
Oh, hello, good morning, everyone. My name is Tyrone Johnson. I am the health chair for the DuPage County NAACP. It's great to see a lot of your familiar faces as well. I'm getting to know a lot of you all as I spend more time out in the communities doing surveys. Had opportunity to meet Joel just recently for the first time in person. I'm more of an in-person type of person. So it's great to be out there with our other community business organizations. So we are participants in the IBACS program. We are conducting surveys as it relates to rapid community assessments. These surveys come from Illinois Public Health Association. The surveys that we chose to use are coming from the vaccine hesitancy toolkit that they provide. One of our first objectives was to find partners within our specified zip codes to partner with to find events that we can partner and provide these surveys. Our second objective was to focus on the survey, and what we decided to do is focus on survey completion. There are approximately 24 questions to this survey. We had options of narrowing down or scaling down the survey with our programmers. But we, as a group, decided that we wanted to focus on the content of the survey and try to address all 24 questions. We had 4 outreach opportunities to do our surveys. Starting in August, we had an opportunity to partner with the African American Men of Unity in Aurora, Illinois, to do a drive-up back to school event. That dynamic of that event, basically there were individuals in their cars. They were waiting for the event to start, which allowed us to go and survey approximately 50% of the participants there. It was a mixed group of participants. Hispanic, African American were the dominant participants with our survey at this event. It was well received. Our next event took place in Naperville. Actually, it was a Success District 203 cookout where individuals from around the various cities came and had a cookout. And it was really good dynamic. It was predominantly Black and brown at this cookout. So we had an opportunity to survey individuals with a little bit different of a platform. We did have a table there, so we were able to approach individuals, and individuals were able to stop by our table. In September, we had an opportunity to do the breast cancer awareness walk at Kentigny Park with the Strides group, which was a lot of fun as well. Once again, a different dynamic. Individuals that were surveyed, they did consist mostly of Black and brown cancer survivors, and mostly in that group, I want to say 90% of the individuals surveyed were vaccinated. So that presented us a little bit of a different dynamic. So we're learning from each event that we actually attend in regards to the surveys. Our final event just took place earlier this week. It was in Glendale Heights, a health fair. That was another different dynamic of events because the vast majority of participants there were Hispanic, Caucasian, and Eastern, Middle Eastern. Very few Black and brown participants at this particular health fair. The majority of the participants in a combined analysis that were vaccinated, the majority of the participants were vaccinated, I'm stating. Most families with children that were eligible to be vaccinated did express that they would get their children vaccinated. As it relates to the non-vaccinated individuals, most non-vaccinated individuals that we surveyed did say that they were not going to get their kids vaccinated as well. As we looked at our survey, there were some common themes. Our question number 6 states, in the last month, have you seen or heard any negative information about the side effects of COVID-19? The common theme that we have seen is that most non-vaccinated individuals have not heard of any negative information in the past months as it relates to COVID-19. So that was a bit striking to us.
Yeah.
One of the next questions that were striking to us was that the question reads, where do you get information from your trust on COVID-19 vaccine? Out of the non-vaccinated participants, social media, Facebook, Twitter, and Instagram was the number one theme, was a common selection for the individuals that were non-vaccinated. I have one more, and I don't want to take up too much time because I know other organizations have some great information to present as well. The question is, which one of the following best describes the reason you did not get the COVID-19 vaccination? The most common theme for the non-vaccinated participants was the fear of side effects. There were also government bad medicine statements as it relates to the non-vaccinated. So in conclusion, we had an opportunity to do over 100 plus surveys. Our surveys, we are using IPHA's platform of surveys, and we are using paper. Our biggest barrier is basically, today is taking that paper and turning it into a computer based survey utilizing SurveyMonkey. We'll have a better opportunity to engage the participants with that. We did have a lot of hesitancy with our surveys, I must say. Individuals, they did not have time to do the surveys. Our surveys are 24 questions, so it is a bit lengthy. We are thankful for those individuals that did participate. Some individuals just said, I'm already vaccinated, and kept moving on. So there are several challenges and several barriers. What can this team do to help us? Number one, definitely let us know, keep us in the loop as it relates to any events that are going on in the Bensenville, Addison, Aurora, Glendale Heights areas. We appreciate working with you all, Cristobal. I know Tamika Booker has been in communications with you, Joel as well. And we appreciate your supports. Thank you.
Hey, Tyrone, thanks a lot. Karen, you had a question about zip codes, and I think maybe Tyrone addressed that in his wrap up. But Tyrone, could you clarify, what are the zip codes that you're working in?
Well, let's see, I have to pull that list up. I tell you what, I could drop it in the chat. I don't have them off memory.
Very good. And
Yeah,
I'll drop
Dave,
our zip code in the chat.
Dave, thanks so much. This is Karen. The basis of my question is, yes, understanding the specific zip codes, and then also how the different groups intersect with each other, or do you all have distinct areas that you focus on? So just not really understanding this program, and I would appreciate your help with that. Thank you.
Sure. The IVAX program that we're participating in has given us a listings of zip codes where there has been low vaccine uptake. This data had been collected through the PHN program, Pandemic Health Navigator program, which we were participants in as well. And the whole focus of the IVAX program is to engage communities of low vaccine uptake, understand why the hesitancy is there, and to work with organizations to address that hesitancy and increase uptake, vaccine uptake, number one.
That's phenomenal. Thank you so much.
Sure.
And Cristobal, you've got a hand up. Jump right in there.
Good morning, David. Good to see you, my
Good
dear
morning.
brother.
Good to
Morning.
see you.
Morning, everyone. Buenos dias. Yeah, you know, like Tyrone was saying, we are working right now to in the Latino community to really change these numbers around. It seems like we've been vaccinating for about 1.5 years now, ever since the vaccine came out. And last year there was a big uptake. You know, we had vaccine clinics here in. There was 200 people vaccinated. In Aurora, we had a vaccine clinic last year where 300 people were vaccinated. Now we seem to hit this wall, and kind of like Tyrone is saying. So we're trying to figure out what's going on. We're also working in the IVAX program along with Brother Tyrone and Tamika, SIP. And so we're really trying to get our major regions are Glendale Heights, where we started Immigrant Society page, Bensenville, and Addison. And so we've been going in there and doing what we're really trying to do in the Latino communities is just wake people up. You know, we're losing 30,000 people a week. About 25% of these people are Latino that we're losing. Here in DuPage County in 2020, 5 times more contagions of Latinos and our African-American brothers and sisters than anyone else. We're in a group called Illinois Unidos, a Latino COVID advocacy group. We've lost 6 years of our collective lives. We're losing, we're still having about 50,000 contagions every day of COVID. So these are big numbers. And, you know, we really want to go into the community and say, wake up, you know, because as we're seeing, chambers of commerce and, you know, I think a lot of government officials, was it last week or 2 weeks ago, President Joseph Biden declared COVID over, you know, that COVID is gone. And we've been hearing this all throughout, you know, to the detriment, particularly of the Latino communities that are in the factories, that are in the warehouses, that are in the restaurants. We know a particular factory in West Chicago, Gelsord, where a lot of our members work, and the people are packed there like sardines. There was a huge COVID outbreak there in 2020. In fact, it was in the Daily Herald. Immigrant Society page through our Casa DuPage Worker Center organized a sick out. You know, sick out is where just no one shows up to work because of your health. Well, health and safety comes first in a workplace. But this is, and now it's sad to hear that this factory in particular has no more COVID protections, you know, no more walls, no more barriers, no one's wearing masks anymore. So again, we have almost like a dry wood here, you know, just ready for this flame to catch fire. And in Immigrant Society page, along with, you know, our partners here in this call, we're trying to mitigate that disaster right now. We had 3 weeks ago, we were in Glendale Heights for our first Latino health fair. So we had Access DuPage, Joel was there. We had Dr. Saima, good morning, Dr. Saima was there. And also we had the Advent Hospital, the formerly the Glendale Heights Hospital was there. And we were bringing people in, you know, getting people vaccinated, but also talking, we got about 25 people vaccinated at that event, but also getting to the social determinants of health, because as I was speaking with Tamika yesterday, that's really why the Latino community and the Black community was so rife for the picking of COVID. You know, we were already sick. We were already without health care. We were already, you know, a lot of the folks that we're seeing that are taking the surveys, you know, they're telling us, you know, well, I have untreated diabetes, you know, because I don't have health care. So we're trying to prop that up now that Medicare is open for people 42 and above. We're really trying to make a move to get people registered on that in the coming weeks. We're going to be working with NAACP next week to do a conversation here in Casa DuPage about what's going on in the framework of what are we seeing, what are the obstacles, what are we going to do to get past them together. Also, Immigrant Society page has engaged members of faith. We have the DuPage Immigrant Ministry inside of Immigrant Society page of the Liberation Theologic Tendency. And we've been talking to faith leaders because unlike other communities, it's been faith that has been a huge barrier Latino community. You know, people saying that, oh, the Catholic Church says the vaccine is bad. You know, Pope Francis doesn't want you to take the vaccine. It's part of the fact Pope Francis is vaccinated. Oh, well, it's another vaccine in Italy, you know? So it's just kind of like on and on. So we're trying to group together progressive members of faith, like our dear brother, Reverend Brignones. I don't know if he's on the call, but you know, if it's always our dear friend, the Diocese of Joliet Peace and Justice Ministry, who we work with intimately. But that's a force we're trying to do, putting together Latino progressive clergy out there to go out there and, you know, speak the good word. Because as Pope Francis said, getting vaccinated is an act of love. And that's always something that we've pushed. You know, as Rafael from our group, when he got vaccinated, said to the press, you know, I'm not getting vaccinated for me. I'm getting vaccinated for thee, or for you. in Spanish it rhymes, but you know, anyway, you get the point. So we're trying to, we love being in this coalition. We really want to heighten the activity. I think a united front right now is exactly what we need. And we are working in the PHN grant and also, as I mentioned, the IVEX grant. So we were one of the most active groups in the last grant, and we hope to continue being one of the most active groups. But now, you know, further, David, and I think you really feel this vision, you know, we can do much more together in the nonprofit world than we can to get apart. And that's why I'm so excited about it, working with all of you guys. So good morning to you guys.
Thank you,
Can I-
Cristobal. Go ahead.
Thanks so much, and I apologize for jumping in again, but I'm wondering, is IPHA then monitoring and providing you all with updates on the vaccine increases that are being seen in the zip code areas, or how would we get that information? Because the work that you guys are describing is fantastic. I'm just wondering what kind of impact it's having and how we can promote some of these, some messages to really counter some of the the information you're gathering, which is priceless.
Karen, so yeah, the IDPH, you can go on their website, and I'll share this with everyone, and look at the vaccination by zip codes. How many people are vaccinated, how many people are not. So that's why we're particularly in Glendale Heights, Bensonville, and Addison, because these have been identified with people of, you know, low vaccinated zip codes, where we want to go in there and turn that around. Aurora, where we've also been tasked to work because it's region 8 inside of the IDPH. It's I don't even think it's reached 50% vaccinated in the 60505 zip code. So we're trying to go into some of these zip codes here and, you know, just really motivate and agitate and really get those numbers up. So yeah, I will share that with everyone because IDPH has a lot of resource. Every week we also get a weekly report on what's going on that I read assiduously. So I would be happy to share this with brothers and sisters on this call.
And I can just add, hi, everyone. Good morning.
Morning, Jose. Thank you, Cristobal. Morning, Jose.
Thank you. Yeah, I'll just add and start with, we are doing the IVAX grant, but we only got funding for Region 7, which is Will and Kankakee area. So we're doing, you know, but obviously because of our overlap in our area and, you know, and the work that we do in both Will and Southern DuPage County, we're still focusing some of our efforts in you know, Southern DuPage County. And not necessarily through that grant, but, you know, through just our health justice initiatives. And one of the things that we're going to be working on, and we're still in the initial phase of this RCA process of surveys, and we're really focusing more on like one-on-ones, which is also like another way of collecting data, right? And then focus groups. We thought focus groups were not going to be the best way for us. We really thought surveys were going to be the best way, and then also just having, you know, in outreach events, having those one-on-ones with community members. We also understand that the surveys can be a little intimidating, especially when it's 24 questions and it's not super inviting for folks to, you know, especially if they're feeling hesitant about the vaccine, on telling us, you know, 24 questions on why. So yeah, and then, you know, we started a conversation with Catholic Charities here Katie, I think I thought I saw her on. And what we're planning on doing is, at the end of this year, whether it's November, December, we're going to be reaching out to some of you all, is we have a group of about 95 families about in the Lisle Woodridge area that were part of our financial assistance during like COVID. And, we want to make sure that all of them have access to like all the resources that are available to them in Southern DuPage County, as far as, access to DuPage or getting them enrolled in Medicaid, and then also making sure that they have access to the vaccine. So, we're still in the planning phases of that. So I'll be reaching out to some of you all in the next few weeks, as we're currently onboarding our health justice lead organizer and an organizer. So we'll be having 2 new folks joining our team and helping expand this work, which we all know we need more of, right? Doing this important work. So thank you all. And I did include the survey in Spanish as a Word document, and then also like the zip codes, which maybe you all have seen before. I'm happy to answer any questions if any of you have them.
Well, really, really cool to hear. This was kind of the first time since IVAX launched that I got to hear so much about it. So thank you for being so generous with sharing, and thanks for the work that you're doing. I don't think that we could help with a 24-question survey because of the challenges of putting that out electronically, but I did want to extend an offer amongst our Access DuPage members. We have the ability we could potentially parse the survey if there were pieces of it that you wanted to include, but in a more limited way. We would have the ability to both send the survey by text to our Access DuPage members of the zip codes that are focused on in Spanish, and would also be able, in fact, to go one step further and send it to our Access DuPage members in those zip codes who have not reported being vaccinated yet. So we could actually look at a subsection if that were helpful. Reach out if you're interested in exploring it. But realistically, we really have learned that if we're going to launch a text-based survey, we have to keep the question list brief. So we would definitely have to make some decisions to make that work. Let me know if it would be helpful, though.
Kara, it would be just great. I think we would love to get 50 surveys coming out of DuPage every week. And this really helps because they're good. There are a lot of questions, but, as they say, they're good questions. They kind of focus in on what the root cause of the fear and the paranoia. But if Access could help us out, I think definitely NAACP and ISD, perhaps ICIRR, we could form some kind of alliance here.
Let's talk further and see how we might be able to either break it into components or do something. We'd be happy to try to help. I just know you'll get a very low return on the 24-question survey electronically. It just doesn't work very well.
Yeah, we see that as well, and we definitely need to get it electronic as well. But that is going to be extremely helpful. We will definitely take this back to our programmers with the IVAX and see what we can do to make this happen.
This is incredibly helpful information and a reminder wake-up call. The awake metaphor, Cristobal, is really helpful. We're pushing against a broader public relations issue as folks are trying to get past this while there are still lives at risk. I wonder, so there's been a couple of things, a lot of going on in the chat, and one of the themes in the chat, Sarah, you're raising up from West Chicago. We've just heard reports from the IVAX and PHN funded initiatives that intend to focus on some specific zip codes, but we know that those aren't comprehensive or inclusive of all of the need in DuPage County. So I want to take a minute maybe to explore a little bit about what's the way that we can support communities. What lessons can we learn from the supported communities and organizations regarding bringing value to those communities that aren't in the grant scheme? And Sarah, you mentioned, hey, this would be good for us. And I wonder, Sarah, if you could chat for a minute. You've heard about survey work, you've heard about vaccine event work, you've heard about communications and collaboration. Are there any of those things that you're saying we could benefit from this? And what's going through your mind?
Yeah, absolutely. And I think as it was mentioned in the chat, I wonder, it's interesting that West Chicago was left out. You know, by the last census, we're 53% Latinx, Latina, and our schools are 80%. And we know that among school-age children who we have struggles and outbreaks currently going on in our schools, and then those parents have to figure out childcare, like the ripple effects of the already stressed socioeconomic standards here are an issue. It's interesting that we were not included in this, but Healthy West Chicago, Jewel Osco, who's been a huge partner and did run a few of our large COVID vaccination clinics right when the vaccines came out. They are doing a few flu shot clinics with us. And then we have a couple large, our downtown trick or treat, which brings over 1,000 families to downtown. And then Frosty Fest, which is in December. I'm going to reach out to Kara and Karen about ways that we can partner to make sure that we have vaccination vans here. And the schools, which I know are just completely overtaxed, but something that Healthy West Chicago has been reaching out about as well as we look to do the flu vaccination. The high school is willing to host that, which would be great to also partner that way. We have a great relationship with St. Andrew's Church, which I know Immigrant Solidarity DuPage works really closely with as well for when they do the food dispersals every Saturday morning. But I'm also wondering if there's other areas, especially as we look at youth to target to get them vaccinated. And if there's ways that we can modify surveys, we Go Together for Kids here in West Chicago, which has about 40 partners that specifically works with families with younger children, where we can push out through our partners, which I think would be helpful to also get additional data and would help us as well as we look at education outreach, which as Cristobal wonderfully encapsulated, it seems like the world's moved on, why many of our Black and Brown communities are still really at risk. And when we're still losing such large numbers, we're also trying to figure out the mental health aspects and the ripple effects of when you lose a family member to a disease that the world is now saying is over. It's really tough.
Thank you, Sarah. So that's really helpful. So you've already started your linking with folks who are involved in the projects. And I just, one more kind of blanket inquiry with those folks who are funded through this initiative, who, what great work you're doing. It's just incredible. There's just how wonderful that is that you're doing person-to-person contact. Are there any things that you can think of in the work that you've been doing that you think are transferable to West Chicago or to other communities that maybe we haven't yet identified?
David, if I can it's good to see you, Sarah. Just talking about West Chicago, we love West Chicago. And definitely, Sarah, let's work together in West Chicago. Building some kind of creative initiative. I think creativity is often lacking in stuff that we do in the nonprofit world, but adding some kind of creativity there. But also, I was going to mention that when we did our Latino Health Fair a few weeks ago in Glendale Heights, there's a lot of people getting the flu vaccine. They were coming in and they wanted the flu vaccine. But what we were linked to our Latino brothers and sisters, I think it was almost 100% Latino there. There are 3 times more people dying of COVID than the flu. And this has been come out in study after study. I mean, the flu is dangerous, but I think there's this rhetoric that COVID is just a bad flu. It's just a bad flu. Don't worry about it. But in fact, it's not a bad flu. The flu it's killing 3 times people 3 times more. So linking that right now is a really good moment. The sweet spot, linking the flu vaccine, which people are getting, and I see it's popular. From our Latino Health Fair, but with that COVID vaccine, reminding folks, this is the flu, God bless, God bless you for getting that vaccine, but we're losing 3 times more on that. I just want to say, David, also Addison. I think Addison has been, I see our dear brother, our dear sister, Gavi, here from the library. We would love to touch base there. I know Addison was the hardest hit community of all. when the COVID really just struck us hard, and we saw so many brothers and sisters in Addison. We don't do a lot of work in Addison, but we would love to kind of, put it in second gear there, as that's one of our territories, and coming in is a front into Addison, along with our dear sister Gabi.
Thanks, Cristobal. Julieta, I see your hand is up.
Yes. Being with Immigrant Solidarity and knowing Sarah and born and raised in West Chicago, it did kind of feel awkward that West Chicago wasn't included the way they have been struggling. And recently, very active with my colleagues and I in West Chicago and other West Chicagoans, because we have a threat right now where there's this company wants to build a second garbage dump. We already have one. And many people are concerned because we have been doing air quality monitoring, and so far the air, it has lots of contaminants so far in a few days that we have been doing this. Also, there's many things going on in the city that I wish we paid attention there too, and also Addison, because I know Addison struggles with environmental issues as well. So where we have this going on, I wish we focused, yes, on bringing their protection there, because if our municipal government isn't protecting the people, maybe the DuPage County Federation could help, protect the children, primarily the children at the schools. I am the president of the Bilingual Parents Advisory Committee in West Chicago for the schools. So I wish to collaborate, Immigrant Solidarity page, and collaborate to make sure we're protecting, at least in the health care, in the vaccines and everything, bringing it to them, because we're struggling. We're struggling against our municipal government to listen to us. They're not listening. I'm being banned from what's happening in West Chicago because I cannot put out there what's going on. They don't want me to post it. So I have been warned yesterday.
Oh my.
David, may I say something, please? Good morning, everyone.
Good morning, Jan.
Julieta, what I'm hearing, and this is so often the case, where there is vaccine hesitancy, where there is vaccine resistance, it's because there is still a lack of trust. The government is pretty much behind this whole program to get more people vaccinated, and I applaud that. But at the same time, in West Chicago, Sarah, you have a municipality there that is supporting bringing in another waste dump in an area that you can barely drive through without choking. So how does the government take the lead and say, we want to get you vaccinated to protect you, and simultaneously the government is authorizing another dump facility to come in and further pollute air that people have to breathe? And as we know environmentally, how this triggers a lot of other diseases. And I actually read a report yesterday that not only are these pollutants responsible for creating the environment for physical diseases, but also there is a connection or a correlate with mental health. So what are we doing here? What do we do other than throwing money at getting people vaccinated to create a system that is built on health equity, and health equity being showing a concern for all people. Why West Chicago? I guess, Cristobal, is my question.
Oh, indeed, Janice, indeed. I mean, that's a big issue. For people that don't know, as Janice talked, that West Chicago is being targeted. We're on a campaign right now. West Chicago is being targeted for another waste dump, which has triggered the idea of the concept of environmental racism, that communities of color tend to be more impacted by waste dumps. There was a study in Houston a few years ago that of 6 of 6 garbage dumps in Houston, 6 of those 6 are in Black neighborhoods. So we're doing a lot of work there in West Chicago. But let's just say West Chicago really needs that love, and I agree with Janice. I agree with Sarah here, and hopefully we could do something about it. The folks here on this call.
Thank you, Janice, and thank you, Cristobal. Janice, you put into perspective that all of our work building confidence around our specific initiatives around COVID vaccination are so influenced by the things going on in the broader community. And our efforts will be much more difficult if we're not in some way dealing with a vision and a goal that's more broad reaching. And I think that is its own topic for our consideration. And there are 2 ways for us to consider that. One is among this group, and we're going to have some discussion later about what this monthly gathering can be focusing on that's important. Also, in our strategic planning through ARISE, we're also going to be spending a little time today on that. I do want to pivot us now, not to diminish in any way where we've just kind of raised up this big, wide open and important issue. But I'm going to pull us back into what we can be doing in support of that local vaccination confidence building effort. And it's kind of providential. We skipped over an update on COVID and flu vaccination opportunities, but maybe that worked well because we can now bring that into kind of piggyback onto this discussion about how we're encountering hesitancy. And Mila, could I invite you to provide that update?
Yes, definitely. Thanks, Dave. I was thinking it goes great together. And I was also thinking a little bit about how the IVAX grant, even though it only really focuses on the COVID vaccine, there's opportunity there to partner with flu and pneumonia and some other vaccines that are really important to prevent serious illness. And our focus in communities that have had disparities for COVID, they've also had disparities for other preventable illnesses too. So I think, Sarah already started the promotional opportunities and talking about that. And some of the things we were thinking about at the health department, I was talking to Bev Gavendick, who's really close to our immunization program, is making sure that we cross promote. And if the van is going to be going to communities, that we cross promote with those communities, not only at the location we're going to, but across all of you and the community groups that we're looking to serve. So to do that, I think our communication is really important, and Sarah is going to send us some dates on things that are going on in West Chicago. But if all of you could send us your dates on where you're doing vaccine related, especially flu or COVID related events, or where you would like those events, and let us know. And Karen mentioned monkeypox as well. So I just wanted to open it up to talk to you a little bit about how the vaccine confidence issues, how we can address those in our promotion. And if you see areas where we want to do more promotion directly in the community through either your social media or through some of your connections to schools or community groups, we could talk about that.
So there's been a lot of chat about connecting and making things happen. And I have to admit, I'm not able to hold all those pieces together in my mind. Let's make sure that with Mila's invitation, that everybody who's got a thought about opportunities for vaccination that are going unmet, and the resource that's needed is the support of the county to get the right people and technology in place. This is the time to say, where do we need to do that?
Dave, I just wanted to take this moment to extend an offer to everybody on this call. With the help of the Health Department and the Board of Health, the DuPage Health Coalition has free flu vaccine vouchers that are actually, it's great, the partners that are working with Jewel. This is actually a partnership with Jewel, and these vouchers can be redeemed at any Jewel in DuPage County, even outside of DuPage County, but they're specifically intended for DuPage County residents. I want to be clear on that, uninsured DuPage County residents. But if you're doing outreach events in the community, if you're doing vaccine events in the community, this is really a great opportunity, and we would be pleased to give you some vouchers to be able to distribute to those individuals who you identify through your work as not having a pathway to a vaccine. There's a lot of concern because the last 2 years have had relatively low rates of flu, because all of the things that we were doing to keep ourselves safe from COVID also had a chilling positive effect on rates of flu illness. So that has two issues. One, it may be of lower concern to people than it would have been in the past, but also that they have diminished immunity from the flu because it hasn't been circulating in the same proportion these last few years. And so it really could hit people hard this year. We don't want the flu vaccine and the COVID vaccine to compete. We want people to have both and choose both. But we also don't want to suggest that either one of them isn't important right now, because this year they really are both important. So I'll put an email in the chat if anybody wants a stack of vouchers to be able to distribute. They're good now, they're good through February, and they're really intended for DuPage County residents who don't have insurance to be able to get their vaccine. I think they also get a coupon when they get their vaccine to be able to get a discount for their groceries as well on that visit or another visit.
Cristobal, could I just ask you, you had mentioned earlier, if I heard you correctly, that maybe people were more comfortable with the flu vaccine than they were with COVID. And I just wanted to go back to that and see if that is what I heard, and if you have any more insight about that, because I think it's interesting to talk a little bit about, we can learn from that. And then secondly, Kara, I'll take you up on some vouchers for our van and some of our clinical programs also.
Yeah,
dental and stuff. Go ahead. Yes, thank you, Cristobal.
Yeah, Mila, I'm basing that on what we saw at our Latino Health Fair in Glendale Heights a few weeks ago. We had double the number of people getting the flu vaccine vis-a-vis the COVID vaccine, to the point where I was going up to people, I'm saying, hey, what's up? And they just seem more comfortable with the flu vaccine. And, there was some teachers there and people saying that in the workplace or their factories or the warehouse, they were calling for the flu vaccine. So yeah, I like what Kara says, putting these together, let's get both. And we did at that fair have about 10 people getting both. But maybe we could link this together more to really get these up. But particularly as I say, the COVID vaccine, I mean, our numbers have really gone down in the past few months, and it's going to be a real struggle that we have to come together to overcome.
Thank you.
Good morning, everyone. Thank you, Kara. I just came from Houston, so sorry. I won't be able to turn on the video. So just wondering, can flu vaccines be available on site, Mila? This is a question for you. If possible, we wanna plan some events at our food pantry, and it's hard for folks because most of them don't have cars. It's hard for them to go to visit pharmacy. We would love to have the vouchers though, but if it's possible to have those events, and it might increase the COVID vaccine chance.
And Simon, I think that our partnership with Kara and with Jewel and the pharmacies in the past have been how we've approached flu, because it also gives the opportunity for people to look at other vaccines like pneumonia and shingles and things like that, where we want to make sure that we're providing them the opportunity to continue their immunization efforts, either with their provider or with a pharmacy who's been doing sort of the lion's share of flu for some folks. And so on site, we aren't doing flu, but we can combine maybe with some other efforts to give people the opportunity for those vaccines. And while you're talking about hesitancy, do you think people would prefer to get them together Or do you think that they are looking for an opportunity to separate those vaccines? How do they feel confidence with combining those vaccines together?
I'm just thinking how to make it easier for our clients who are coming to food pantry. Perhaps we do some event, food distribution, some other event at a pharmacy itself, where they come and then they get, I don't know, I'm just thinking out loud, how we make it easier, because it's hard for them to come to food pantry itself. And then going to the pharmacy might be even, harder. They just toss it in the bag and throw it out.
I have that concern as well. Dr. Asfar, I know that Jewel was working with Hamdard on doing some community vaccine, flu vaccine events, maybe similar to what Sarah is describing. So I think one option would be to try to connect you with someone at Jewel to see if they would be willing to come on site and do an event. But the other option would actually be just to reach out to Brandon and Hamdard and see whether they might be willing to come to coordinate all of that on your behalf. They're certainly in your service area, so maybe there's an opportunity to, Brandon had said they were looking to expand the number of those community flu vaccine events they were offering this year. So they might be really receptive to a request.
Awesome. Thank you. Great suggestion.
I think somebody asked a question in regards to like spacing out the vaccines. We hosted actually at the Mexican consulate late last year, both the COVID vaccines and boosters, and then also the flu shots. Most people were not that excited about getting 2 vaccines on the same day, although some did, because the nurses were there and they were able to explain like they won't have an impact, and it was Spanish speaking nurses, and that was helpful. But not a lot of folks were super excited about getting those on the same day. So spacing them out, I think, would be good. And I think we did have actually Jewel come out last year and do a flu flu vaccine event with us. And what I put in the chat earlier is we're getting a lot of those calls on people that went to our events, and they're like, hey, we got our shot with you at this community event. We're ready for our booster. When can we schedule? And when we refer them out to a clinic, they're like, oh yeah, no, just reach out to me whenever you have an event. So they want to do it with a community-based organization. So we are seeing some of that, but just capacity also is what's been holding us back a little bit. So we're hoping, now that we're bringing additional staff to the team, that we might be able to host even smaller scale vaccine clinics.
That is what I was sort of wondering is, do we want to make sure we can do some education on, you can get them together, it's very safe to do that, that's okay. But you can also spread them out, and that's fine too. And maybe try to point that out to people so that they think about how they might do that, as we're already getting, I don't know, how are we 8 weeks out from Thanksgiving where people are going to be gathering, and just kind of look at the timing on those things. That's kind of like how we were thinking about this last year at this time.
I want to stay here just for one more moment. This idea that based on your observation, Cristobal, that folks were more likely when both were available to go for the flu than the COVID. So why is that? And Jose, you've noted that some people just don't want to get 2 at one time. Amelia, you're noting that education can help do that. I wonder if other folks are seeing similar discrepancies, and I wonder if there are other thoughts about what's going on with that unwillingness to do both of those at the same time.
We saw a few on social media, people posting about having a worse reaction from getting at the same time. And that seemed to catch a lot of traction through social media, unfortunately.
Thanks, Sarah. And Jose, I just don't want to let pass without noting what a key clue that is, that when people are telling you they're willing to come in, you just tell them when. And so all of our energy needs to go into how do we make the events where people do want to come, how do we make them happen? and routine and financially support them. And wow, that's golden. I wanted to also, before we stepped into our next area, circle back to a couple of things that I'm not sure everybody saw this in the chat. Jose, you mentioned the importance of booster messaging. There was a resource shared in the chat, but that's something for all of us to be thinking about. That's where you're getting questions. And Mimi, you did some forward thinking about, so who are the trusted messengers then? And I wonder if I could just ask that as a blanket question right now. Here we've got this level of experience in engaging people in education and in vaccination. Any thoughts coming back from people about who are the trusted messengers that we want to be supportive of and want to be making sure that they get visibility and traction? Any observations about in your community with your work, where are the messengers trusted?
Oh yeah, see you.
I might not have asked the question in the right way, or we've had many good indications of where the trust is existing with organizations that are providing the vaccine in the community in a way that feels welcoming.
I think that people don't answer because the truth is the trusted messengers are the people in the call, and they don't want to they don't want to sound as though they're being, but it's a credit. It's a credit to SSIP and ISD and ICNA Relief. I mean, it's really a compliment to all of you that that you've earned that trust. It's well-founded.
Yeah, I kind of felt like, well, I don't want to be like, oh, well, the people come to us, blah, 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 no. But, not to be, ego here, but it is apparent by colleagues and by people come to us or come to Casa de Page with questions. They'll call us, and I guess being an organization for the community and all the work we have done along with the others that are in this call, not just us, center, I guess, more on helping us bring things to the community. There is a tremendous need still. Unfortunately, the country's thrown the towel, but it doesn't mean we can't continue working at this. We know the problem's there. We know that there is still a crisis, especially because everything's so expensive. And the reason I might want to be a bit on the side of the workers, okay, where they want to be able to, the day off that they have, like on a Saturday or something, be able to get everything they can get, just 2 shots. The health fair we just had, people were getting screenings for diabetes, for the heart, for cholesterol. There was also, I believe our sisters from DNA had for breast cancer awareness. They had that going on, and they're going to work with us this month again. And so this is where we have a clinic or something that we can bring out to the community. This is where the people come because they want to get this care that they can't get because they're working. They're working maybe 1-2 jobs during the week to make ends meet, to try to make ends meet. So.
Thank you, Julieta. I want to link something you just said about solidarity with workers. And Mila, you dropped in the chat information about pneumonia vaccination for folks 60 and over. Our data in DuPage shows that the 60 to 69-year-old folks who are Latino and Hispanic are absolutely at the top of the scale in terms of risk. Do you want to talk about the pneumonia vaccine and how that fits into the mix?
Yeah, David, I was thinking about it a little bit because there are a number of people that, if they're still hesitant about COVID, the COVID vaccine, the pneumonia vaccine has been available and they may be more comfortable with that. So if they, everyone who's appropriate to get that pneumonia vaccine should, but it may be a sort of a fail-safe if they are not interested in the COVID vaccine. Same with flu, as Christopher was talking about people's comfort level, maybe it's different. I just don't want to leave that out because it could be protective for secondary infections and for pneumonia. We really have no way of telling what the winter season will bring. So this is sort of the opportunity to be doing vaccine confidence on all those vaccines. And it's great to focus on the COVID vaccine. It's really important, but from these other ones, I wanted to bring those in too. And I didn't know if anybody had insight on how our residents are feeling about the pneumonia vaccine and if we needed to do any promotion on that, because that isn't one that you typically see promoted, all the time.
Thank you.
Dave, one thing to add on trusted messengers. I don't know if this is fortunately or unfortunately, one of the things we've noticed is folks listen to a lot to ethnic media, whether that's radio or that's Univision, Telemundo, whatever folks hear there. We have partnered before with like Aileen Ocaña, which is a trusted radio host, and she does a few PSAs, and those have been helpful in getting people calling our office and whatnot. But there's also a lot of misinformation, right, that often gets shared. So just that is a potential resource, right? How do we tap into those networks and get the word out on either events or different things that we're all doing.
Thank you, Jose.
I can't remember what we called them early on, like 2 years ago. I think, Michael, you were one of our first. Can we call them health ambassadors that we did the little mini videos?
Oh, the champions.
Yeah.
The vaccine champions,
There you
yes.
go. I feel like that's what we're talking about again, is to revisit that. Perhaps, it doesn't have to be a professional video. It could be a cell phone video or something, but to really work in getting the trusted messengers back out, because that was the whole idea, right? Michael and others who were involved, Dr. Asfar was involved, is to get trusted messengers in front of populations that it would resonate. And I think we're back to that place. And I feel a sense of urgency heading into these winter months with COVID, with flu, with some of the others. So I just think that might be something to explore further.
I absolutely agree.
It's relevant just because we're in the beginning of October, and it means that likely we will not meet again. I can't remember the date of our next meeting until open enrollment for the ACA has already begun. But as we're working through how to message all of these components, I think we all recognize that insurance is not the answer, but it is a piece of the puzzle. And so what we really want to make sure is that all of these families who are disproportionately impacted by COVID, who are also disproportionately likely to be uninsured or underinsured, we want to use all of the time we're spending connecting with those families to also make sure that they've been screened for eligibility for all of the programs for which they qualify. It can be very confusing right now with health benefits for immigrant adults. People still have concerns about public charge and fear that if they take advantage of the benefits that they're eligible for, it may harm their immigration status, which it will not. But talking about trusted messengers and talking about health equity, I want to make sure we also acknowledge that this is a critical period for connecting people to and getting them enrolled in health coverage for the coming year. It only makes it harder if someone doesn't have insurance when they get sick.
Kara, if I can, and kind of building on what Karen said about the trusted messenger, I think this is super important, particularly in the Black community and the community. One of the things that's come out in Casa DuPage is that people kind of feel like on both sides. One of the things that's lost is the love, the kindness, because you have these conspiracy theories just talking about all this crazy stuff, and then sometimes in ISD in our old days, we'd be like very gung ho, vaccinate, but I think it's sometimes like when I got vaccinated myself and a lot of folks, that we were working with AIMA, and the nurses were just so sweet, they were so kind, and these Latina nurses, and everyone they dropped their armor, and they're like, all right, vaccinate me. And also we had a lot of success in Aurora last year, working out there in 60505, kind of bringing the faith message in there. Getting vaccinated is an act of love. I didn't get vaccinated for me, I got vaccinated for you. I think this resonated particularly with Latinos, that they don't like to see people with an agenda or any ulterior motives. So I like this idea of this messaging, particularly these trusted messengers, doing some kind of videos out there with people of color in the community, going out there and getting this all over, because people do need to see that love.
That's kind of a great closing statement that sums up what we're about. And it could be a good transition point for us to move into our next discussion regarding our strategic planning and the ARISE project. But I don't want to close off this part of the discussion without just expressing incredible appreciation for the folks who are doing the work in the community, who are doing the surveying and the educating and the messaging, Raphael, the modeling, all this good work. This is just incredible. And this makes my morning to hear the stories of what are going on and increases my motivation to want to stay at this and persist for years to come. So thank you all for being a part of the conversation, for the work that you're doing, for sharing the results of that, and for being candid about what others here could be doing in support of you. So I now want to shift and invite.
David, is it?
Yes.
Oh, I was about to ask, is it possible to get a copy of the chat?
Yes.
Great, thank you.
Very good. Thanks. Thank you for asking, Margaret. It's chock full with good stuff. So we want to for sure get that out. It's a resource bank today.
Absolutely. Thank you.
If I may share it really quick, we will send the minutes of the meeting and include some relevant and highlight things from the chat. So it's available for all of us to look at it later. So we'll coordinate that and all of you will receive it in the next couple of days. Thank you.
Thanks, Joel. So that's then I want to introduce Becky McFarland and Joel Hara to talk about the status of the ARISE strategic planning process, how it fits into our heart mission, and what's on the horizon.
All right. Well, you want to go or you want me to go first?
Ladies go first in my book.
Okay.
So you go
perfect.
first.
All right. So as a reminder, some of you I maybe haven't met in person. My name is Becky McFarland. I'm the Population Health Coordinator at the Health Department. And we have been working behind the scenes with some of you on this call to work on a grant called ARISE. So a lot of you have probably heard before, but it's a state grant to kind of, in my mind, like formalize some of the structure around this health equity team. So we know, as Dave mentioned in the beginning, we've been around for 2 years, which is amazing. And it's so exciting to hear about all this vaccine, confidence building activities that are going on. And while we're doing all of that, we think there's a lot we can do, again, with this ARISE grant. So we We'll talk a little bit later about some activities we might try to do around creating some shared goals for this group, or kind of what everybody on this call thinks we can take on in the next couple of months, sort of to set ourselves up for success and, you know, kind of like think strategically about moving beyond COVID, not beyond COVID, but including COVID work and the lessons we've learned, and to not lose that amazing momentum that we've built over the 2 years. So Joel, do you have anything that I missed?
Yeah, no problem. I'm gonna highlight a couple of things. First of all, I'm very thankful for each one of you to participate today, and the energy, the excitement, the passion behind it, because our hearts drive all that we do, and that's obviously the name of heart. So I'm very thankful for that. I'm gonna share just a couple of things, you know, as we trying to understand a little bit between the RISE and heart, you know, who is who does what, and what's the aim. So I wanna maybe address it for a minute on that one. RISE is the mechanism that has partnered with us to make our collaborations more feasible. They are, for lack of a better word, behind the scenes supporting any collaboration that we can do in the community. As Becky has stated, Heart STEM a couple years ago in reaction or in response to COVID. So that's our entity, our mechanism. And the best way to describe it from my standpoint is it's almost like, but to explain it, it's almost like a vehicle. So Heart is the vehicle. We are driving initiatives in the community, whatever we deem appropriate, in reaching out to the disparities in our community. And RISE is the fuel, the fuel's the vehicle to get that done. And that has been helpful to me. Hopefully that analogy is helpful to you. We had a very rich time in Springfield last week, Becky and I, and it was really helpful to meet in person. Incredible things happen when you meet in person. I was just thankful to see how personable the RISE team are, how knowledgeable they are, how great they share a lot of resources. We, as a group, were about 50 folks there. And out of the 50 folks, we are, or all the coalitions, we are the largest coalition in Illinois. So I'm very thankful for that. And there's a lot of ownership of our team. Also, our team was really well represented at Zoom meetings. So I'm very, very thankful for that. So many of you had the opportunity to interact via Zoom and ask questions and be part of the gathering. So it was very rich. So thankful for that. Want to highlight briefly a couple of meetings in person coming up that are in the agenda. One is in January and the other one is in May. We are in the process to have those meetings in DuPage County. So it's not firm yet, but it's very likely, maybe both, maybe one of the two. And you will not regret your time that you can spend with us in those gatherings. So thank you for what you do. And if you have any questions, let me or Becky know that we can answer.
I also wanted to share that as a part of RISE, the DuPage Health Coalition has asked on behalf of the larger group to provide some monthly reporting that captures all of the different activities that are happening in the community to support health equity. And this meeting is a great example where you learn about so many different things that are happening that you weren't even aware of. So one of the requests that I will make to all of the members of Heart is that I think that probably on a monthly basis, I'll send out a message to everyone and just invite literally 1 or 2 sentences back to share or highlight or surface things that are happening within your organizations that are promoting health equity that I may not be aware of. I'd love to be able to tell a more complete story to our partners at ARISE, not because that is an ARISE event, that is an event that ISD is doing or ICNA Relief is doing. Credit for that is with you, but it really speaks to the flavor of what's happening countywide, and I want to make sure that I'm telling that story well. So if you see an email coming from me on a monthly basis inviting that kind of feedback, I wanted you to know why it is that I was asking. I'll include some of that color in the qualitative reporting that we do back for ARISE. Thanks.
I would share one other comment. You know, in my impression from our meeting at ARISE, the gathering, they're not prescriptive of what we do, but they're empowering. And they're really great facilitators and empowerers to see what is the initiative they want to do regarding health equity. And they're great coaches, so I'm very thankful to have that kind of support in the background to assist us in reaching out to the community. So big shot for them. So thank you, everybody.
Oh, well, you mentioned that there were some 50 folks at a statewide meeting in Springfield. Could you talk a little bit about who we're building relationships with around the state? Who are involved?
Sure. I don't have the data in front of me, but basically it's divided between North Illinois, kind of Western Chicago, Western burbs, South Illinois. So there are different coalitions. I know Waukegan was present and they're doing wonderful things in the front. I just don't have the information in front of me. And a couple of 2-3 coalitions, one in Champaign, another one closer between St. Louis and the border city there, I forgot right now. But it was, but we are the one that is heavier or bigger and more focused here in DuPage. But it was a lot of energy behind it, and I anticipate, obviously, because distance and availability, more folks moving forward, at least from the Chicagoland area, will participate. And I encourage you strongly to build collaboration, to build relationships, to hear what others are doing, learn from one another. Maybe we are ahead of something, or maybe we can learn from somebody else as we collaborate. But that was a lot of energy behind it. It was really, it's a really nice spirit behind it. Really kind, really willing to work with one another and collaborate. And there were some younger people than me, a little older than me, a little more seasoned and experienced, but it was all the above. But all of us had the same aim and the same motivation to build collaborations and health equity in the community.
And one thing that I really appreciated about the in-person was that we are able to connect not only to other coalitions in our state, which I think is really important, but we're also connected to groups that are part of a CDC funded initiative called RISE. So that is happening in states across the country. And it's tied to a lot of different national initiatives going on. Like they have some evidence-based resources from 100 Million Healthier Lives, for example, and some different organizations that, you know, we can hopefully tap into and build relationships nationally too. So we'll be sure to keep everyone in the loop with how those types of things are going. But it was, we hope we can bring everyone to the next 2 in-person meetings, because they had mentioned like all of us are welcome to come. So hopefully, you know, they're not both in Springfield and we can have a large group of heart at the next 2 meetings.
I think we're pretty confident that one of the 2 will be hosted in DuPage County at minimum, which will definitely make it easier for more people to participate. And we are lobbying, and I think they'll accommodate if they're able to. It's just a question of where the planning is. We're lobbying for the January meeting to be here, just because we would like to be able to take the benefit of having so many of us participate sooner rather than later. The next meeting is in May, sort of toward the end of the funding period.
Thank you, Becky and Hoel. We're getting linked much more broadly. Thanks for that work. And so any questions about RISE and the infrastructure building and strategy that's going on there? If not, I would invite Becky to bring us back to our group, our priorities, the things that we want to be focusing on in monthly meetings of HEART. Becky.
Thank you. Okay, so I mentioned earlier that we have a survey, and so some of you may have already done that. We got 5 responses when I emailed it out. It's probably been a month or 2 by now. Time flies. But I will put the link in the chat. And basically what this is a way for us to determine what 2 things, so you'll see that it asks you to pick only 2 things out of a list of potential activities. And these are things that we can sort of userize, as well as analogy mentioned, to propel us forward. So I will go ahead and put the survey in the chat. And then if you didn't do it already and you don't mind opening it up, but these are things that are kind of happening, you know, simultaneously to a lot of the work that we do to really set us up for success in keeping heart in the long term and using it to the best of its ability. So you'll see things like creating a formal communication strategy. How do we communicate this to the public? Kara mentioned, you know, wanting to be aware of the different partners kind of events, but like, are other people needing to know about what those things might be? Thinking about who we have on these calls regularly, like, do we have all the right partners, things like that. Some things you might want to include in future meetings. Do we need to look at more data related to certain activities? Do we want to start focus groups? So I know that, like, I've had some people already who finished it make comments like, I didn't want to choose 2, like, let's do all of them. And I'm not saying we're not going to do all of them. I'm saying we need to, you know, prioritize and pick 2 at a time. And then as we kind of build momentum, we just add more things on as we are able to, if that makes sense, or as partners want to take them on. So does anyone have any questions about that before we have people take it? And then we can include the results in the minutes as well.
Thanks, Becky. And thank you for extending yourself to do that prioritizing, to give that responsiveness. All right, so we're at the point of the meeting where we're ready to invite member updates and events. And I'd like to open this up myself. I'd like to suggest that after 2 years, it would be really good for us to have an opportunity to come together face to face safely and celebrate the 2 years of work that we've done together. And I want to propose that idea to this group, see what you think about that. And I want to put out there an idea of getting together on Friday, October the 28th. That'll still keep us within our anniversary month. Wonder what you think about that idea. And if it has appeal to you, then I'll move us forward to asking you to do a little poll response in the chat on whether you'd rather do a start of the day event, a midday event, or a later afternoon close of the day event. So can you give me some feedback? Do you think that would be a good idea?
Oh, indeed, my dear brother. Yes, I think that sounds good. I like the mornings. You know, the morning feels fresh. You feel strong. You know, you got your caffeine. So I would vote for the morning.
David, I think it's a great idea as well, and I would suggest the mornings as well.
I think on a Friday, you'll have better uptake in an earlier meeting than you will at the end of the day.
Very good. So I'm it's a landslide. We will do it. We'll do it on Friday the 28th, and we'll do it at a start of the day time. So look for some more information, and I'm hopeful we can do that in a nice big training space in our office building in Lombard. But I could ask a question about location preference too. If anybody has an idea or a space to offer for this, would welcome that.
Dave, in fairness to you, I think we were doing the survey when you asked the question of what's preference. I like early afternoon, but as Cristobal, I'm a morning person and I drink a lot of coffee, so I'm very energetic normally in the morning.
Very good. Very good.
I think the benefit of Lombard as a potential site is that it's so central. so that no one is traveling across the entire county to get there. And we want it to be as accessible as possible. So I like that location. And I know the room that you're speaking of, and it's well situated for an event of this size.
Very good. So we know that's an option. And if other good options come to mind, please share those and we'll find a way to make this work. And I look forward to seeing you in person. I look forward to that celebration.
Yes. Oh, sorry.
Thanks, Julieta. Now I want to invite any other member updates and events. Is there anything else that it would be helpful for members of this group to know that you're engaged in or working on that we should share?
Yeah, David, I have invitation to everyone. Save the date, October 27th at College of DuPage at 6 p.m. Immigrant Society page is going to be with Unidos. Unidos is a Latino COVID coalition. We are pushing legislation for mandatory COVID workplace committees. This is in factories and warehouses, which we saw in March of 2020, were really the hardest hit. You know, we're really just slammed with COVID cases. Again, 5 times harder hit in the Latino community, particularly at the workplace. We feel there's an undercount and an underestimation of what's happening at the workplace as far as worker safety there, which we're seeing in the Casa DuPage Worker Center firsthand every day. But we are going to sit down on the 27th. We're going to have a forum with there's another Arise group to make it more confusing. Arise Worker Center in Chicago with our dear brother Jorge Mujica, the Unidos Coalition, Alejandra Ibanez, Javier Arellano, and talk about the need for COVID workplace safety committees, the mandatory committees. That this is legislation that we're pushing. We're hoping to get this passed in January. So we're doing a little bit of advocacy here, nonpartisan advocacy here for the workers' rights, you know, the dignity and the decency and the safety, particularly of the Latino community that's out there in the front lines, is essential workers and is being exposed to COVID disproportionately. So the flyer is coming out soon. College of DuPage, we're having one of the conference rooms there. We hope you could all join us. We'll give you a seat at the head table. Thank you.
Thank you, Cristobal.
Fabiola, can I invite you to share more about what you placed in the chat?
Yes, I wasn't sure if Julieta was going to go next since she had her hand raised, but thank you, Kara. So tomorrow, Advent Health will be hosting its medical mission clinic in Willow Springs. I've included the flyers in English and in Spanish. We have different screenings that will be available. We will be offering flu vaccines as well, dental cleanings, dental exams. So please, share with folks who may need those services. And we have some of our partners that are on this call that will be there as well, like ICNA and DuPage Health Coalition. So thank you for your continued support.
Thank you, Fabiola.
Speaking of open enrollment, as I did a little while ago, I just wanted to share an invitation that over the course of the summer, the DuPage Health Coalition has been building up our team of client benefit specialists. So we are now excited to have 4 team members who are able to help people to enroll in Medicaid and or marketplace plans, all 4 of whom are Spanish speaking. If any of the folks on this call would like to collaborate during the open enrollment season from November through January on doing events, perhaps at your locations, to support telling people about the services that are available to them and helping them to enroll in those services, I'll put my email again in the chat. Please reach out to us. We'd be happy to see about sending team members to participate at your locations or co-hosting something alternatively. Thanks.
If I may add, also, we can provide flyers for you if it's helpful tool prior to the events or for you to promote with your network. Let me know or Kara know, and we'll be happy to do so.
And David, next Thursday, I'm speaking at Good Sam on building health equity in the DuPage, in the Black population in the DuPage community.
Are we able to join in? Jan, do you have any details?
I don't know, Mila, can we invite them?
Yes. Well, I don't know. I guess, is this to the foundation?
Yes.
Who are you referring? Oh, so Dave, this is to the Advocate Good Samaritan Foundation group.
Got it,
So I
got it.
generally think, and I don't think they figured out how to do that like hybrid or virtual yet, but maybe that will grow to something with Advocate that would be really beneficial for this group to have input on and Jan to share too. So Jan, maybe that's the next step, right?
Yes, but this is not necessarily, that's for DuPage. I'm also on a committee that is looking at putting together a health equity fair that we are going to initially address providers of healthcare. And this is in Kane County. And after that, we will open it up to general public.
Very good, Jan. Thank you. And also thank you for taking the message about health equity in your presentation there at Advocate. All right. Hearing none others, this is an unusual morning. We kind of extended ourselves beyond the hour and a half timeline. We're a little bit beyond that now, but this seems like a good time for us to close out unless there is anything else that it would be good to share. And I want to recognize we have a volunteer, Tamika, willing to take us through some Zumba when we get together in a few weeks. So morning lovers, coffee drinkers, be ready. You can get your fix there. You don't have to go to your 7 a.m. class. Come to the 9 a.m. event as Heart celebrates 2 years.
Okay, that's awesome. I put in the chat, since we're so engaged right now in West Chicago with what's going on, we have been holding community meetings for this purpose of the waste transfer station and the environmental issues we're facing. And our next, you're all invited to come and join us in support and listen to what we're saying. It's going to be at the West Chicago Public Library at 6:30 p.m. on Wednesday, October 19th. We're trying to draw people about what is going on, what are the dangers are, what are we trying to do. So because the city of West Chicago wants us to have the public hearings in December. Well, in December, everybody is going about their festivities for the winter, for Christmas, what have you. So people will not be around to face, to say, and they'll be busy. You know, it shouldn't be a time. I think Christmas shouldn't be a time to sneak in a garbage dump like that, you know. So we need, what we're trying to push at the city council meetings is for them to push that public hearing after the holidays, where the public, especially our Latino community who lives there, has the opportunity to come and look at our research that we have done, look at the results that have come up, and then make their informed decision and come help us say, no, we don't want this here. So please join us for, if you can, if you're in the area, if you can, come join us in support of this cause on Wednesday, October 19th at the West Chicago Library. And it's at 6:30 p.m.
Thanks, Julieta.
Dr. Asfar?
Yes, awesome. Such energy, you know, wow, amazing group. So I have two suggestions, two things. One is November 5th, we are doing an event at Islamic Center of Western Suburbs. And hopefully we will have caravan, and if any partner would like to join us, that'd be great. Basically that mosque started to ask and they want to do some events. So basically they are the main host. Second, I have a suggestion about our meeting, coffee meetup or whatever we are doing. If we can have a videographer available at that time, all the leaders will be there and we can do testimonials and other things, we can make nice videos. Just a suggestion that we can just do 2 things at one time.
That's really smart.
Yeah, that's very wise, very wise. Thank you.
David,
And-
lastly, I want to call attention to an article that Rashmi put in the chat from New York Times. Why we are surveying the MENA community. I think I sent a copy of that to you, Dave. That is an excellent article, and I would encourage everyone to link on to that article and read it. It's very insightful.
And I'll piggyback there, Jan, with a big shout out and thank you to ICNA Relief, to Dr. Asfar, to Hulud, Atia, and all the staff and volunteers that have supported survey work regarding Middle Eastern, North African identity and healthcare. So Tim Ackerman of NIU, public health master's student, has been with ICNA Relief for the last 2 weeks at the food distribution program, surveying folks coming through. And the information that's coming in is incredibly invaluable. And it's the credibility of Dr. Asfar, your staff and volunteers that makes it possible for this information to be coming in. So we're getting a firsthand view of how folks feel about their healthcare identity and terminology and what they would like to see going forward. So thank you.
Thank you, David. We would like to thank you especially for doing all of this work. And our team is super excited to have you over there. They were just feel so energized because of your presence, and we just cannot thank you enough. Thank you so much for stepping up and partnering in this great cause.
Sure. So this is a step along the way, and our goal here is to produce a recommendation for healthcare providers regarding the ways that they can change the way they collect information that's going to be consistent with how the community identifies itself, and provide them information, empowering information about their care.
And I just want to say, from the feedback, the early feedback that we received from all of our health system partners, as we were asking the question of how they were themselves tracking data, the bad news was that I think everyone who responded confirmed that they were not currently including a category of MENA or something similar in their demographic data collection. But a number of them also indicated that they were frankly embarrassed about that fact and working and already in conversations internally within their systems on trying to adapt their data collection to do better in the future. So I think that the work that David and Tim and Dr. Asfar and others are doing is timely and helpful and should be shared back with them. But I think you'll find greater receptivity to that feedback now than perhaps you would have seen a year or two ago. So it's sort of a confluence of events, which is a great thing.
Thanks, Kara. And a shout out to Kara for being a relationship builder with healthcare systems, to Fabiola and representatives at other healthcare systems who are giving us the information we need to understand how they're collecting and categorizing currently. If there's not anything else, this is a time then we'll come to a close. I want to say to all of you, what an incredible group, what an incredible meeting this morning that grows out of the fantastic work that you're doing in the community. So deep gratitude, and I wish you all to stay in good health, and I wish you all to stay fully engaged, and lets us be